So HMPL-523 is an oral Syk inhibitor that in preclinical models of lymphoma has shown significant activity as compared to other Syk inhibitors currently available in clinical trials for this disease type. One advantage is that it's very specific to Syk, and as such is supposed to have very high potency with limited toxicity due to potential off-target effect. Years ago, we performed a phase 1 trial that in the escalation phase allowed inclusion of multiple subtypes of lymphoma, including non-Hodgkin and Hodgkin lymphoma. And due to the biology of lymphoma, at that time we felt that subtypes such as CLL would have been those benefiting the most from Syk inhibition. But to our surprise, in the escalation phase, we saw very significant activity in classic Hodgkin lymphoma. I'm saying very surprisingly because, of course, the B-cell receptor is not relevant to Hodgkin lymphoma biology as much as it is in non-Hodgkin lymphoma. Though there are some increasing data showing that Syk inhibition may be relevant to the immune microenvironment surrounding the rich membrane cells, and in particular tumor-associated macrophages and natural killer cells. So based on some preclinical rationale and the initial preliminary clinical activity that we saw in the escalation phase of this trial, in the expansion phase at the recommended phase 2 dose, we created a classic Hodgkin lymphoma cohort. Overall, we have enrolled 20 patients, and the safety profile was very promising. The main expected toxicity was LFT elevation. That was really the dose-limiting toxicity, based on which the recommended phase 2 dose was identified as 700 milligrams PO daily. But most importantly, in patients with relapsed refractory classic Hodgkin lymphoma, we're running out of standard options, including chemoimmunotherapy, anti-CD3, monoclonal antibodies or ADCs, immunotherapy, and transplant. Syk inhibition was able to induce very durable complete remissions. And while some patients, very young and fit patients who were able to achieve CR after all standard treatments were exhausted through Syk inhibition, were then able to proceed to allogeneic stem cell transplant, some others actually stay on treatment, suggesting that Syk inhibition in classic Hodgkin lymphoma may induce MRD eradication even in heavily pretreated patients. Based on this, at EHA this year, we will present our clinical data, and we hope as a next step, based on some translational work that we're trying to perform on pre-treatment tissue samples and progression tissue samples, to better understand the biological mechanism of activity but also resistance of Syk inhibition in Hodgkin lymphoma, to identify the ideal companion for future combination for upcoming phase 1, phase 2 trials of Syk inhibition in lymphoma.